Welcome back, everybody. If you are feeling tired, if you're feeling run down, you're having a hard time losing weight, there might be a medical reason. Dr. Joshua Redd, chiropractic physician from Red River Health and Wellness, is back on the show. It's good
thanks
to
for
see
having
you.
me.
And you brought a patient with you.
I did. I brought Trina because I think this is what a lot of viewers are suffering with, and they don't really understand what's going on.
So, Trina, tell us about you. What were you going through?
Oh, I was tired, exhausted, didn't want to get out of bed. I looked different in the face. And I'm a mom of 2 little ones, and I run a full-time real estate business, but I didn't even want to leave my bed.
Did you blame it on a million other things?
I did. I'm tired. I'm a new mom. I'm not sleeping much. And I would always turn to caffeine, which caffeine had a lot of cream in, and I was doing some damage with the items that I was turning to.
When did you say enough is enough?
Well, I was being treated by my physician, and I just wasn't improving, and I was taking a lot of medication, and there's, you know, so many different side effects to medication. So I actually reached out to my sister, and she said, I need to connect you with Red River.
So you go into Red River, and Dr. Redd, what do you do first?
Biggest thing is do the medical testing necessary to identify what in the world is causing this patient's symptoms, right? Most of the time we just do simple tests and they get put on medication and they see you back in 6 months, but that often isn't enough. And so when we're dealing with a chronic patient, you really have to uncover the underlying issues, the underlying imbalances, identify what dietary and lifestyle triggers cause it to flare up as well, and really put a piece and a plan together to help them improve long term, right?
Do you hear what Trina is describing frequently in your office?
All the time. Like if you sat in my shoes, you get to see what patients were experiencing and the lack of hope that they have when they first come in, like you'd be mortified. Like, I mean, this is one of the best, most rewarding jobs on the planet because we get to help so many patients. But if you could see their story and what they experienced prior, you would be completely shocked.
Did you
it's
feel
heartbreaking.
Listened to finally, like someone understood what you were going through?
Oh yes, because I would blame a lot on the disease. I have thyroid diseases, and it's like, oh, I'm just tired because of that. And it would be like, here, take this pill. Well, when I called them, they did so much deep testing and listened to me. I could say, I'm feeling this way, and they would know exactly what I was suffering from. It's mind-blowing because I've never met physicians who care so much, who listen and take their time with you. I didn't feel rushed. I didn't feel like a number. And everything that they shared with me, the light clicked on. It makes sense, and every body is different. So it's avoiding those things that were causing my inflammation to trigger, which will cause the disease to trigger, and me not want to get out of bed.
So what's the difference now? How are you feeling now?
So good. I can see the difference in my face. So I naturally have, you know, little chipmunk cheeks like my dad, but I don't see the inflammation like I did before. I jump out of bed, I don't drag myself out of bed anymore, and I don't need the coffee. I'm avoiding the caffeine because it's me. I'm avoiding all those triggers, which I'm good.
I think you're not alone with the caffeine. I think so many of our viewers say this might be the answer because I don't know any other answer.
Yeah, I think a lot of people too, they're busy, they have high stress lives, and they just pawn it off at that, and yet there's underlying issues that just aren't being uncovered that are slowly getting worse and worse and worse, and the proper, you know, help is needed. But they blame it on other things, kids, whatever it may be, and it never gets uncovered.
I love when Dr. Redd stops by because he yells at the screen, there's hope.
There is.
Trina says there's hope.
Yes.
We see this every single week, and it's so fun. And here's the thing, like, we're not going to take away your physician. Like, we'll work with your doctor hand in hand, and we're the biggest advocates of them. It's just, let's get to the mechanism of why these patients feel bad. Let's teach them, let's educate them, let's show them what to do and what not to do so that they can be the expert in their own health. And let's give them like a path of hope and a path of, you know, happiness and help, right?
If you have questions, everybody, call for a free consultation. Locations are in South Jordan and Logan and St. George. The phone number is right there on your screen. Also the website, redriverhealthandwellness.com. If you go in for a consultation, you mention that you saw this on Good Things Utah, you get a free copy of the #1 best-selling book, Thyroid, The Truth About Thyroid. Thank you, too, for being here.
Thanks for having us.
Thanks for having us.
We'll be right back.